Hello.
Hey, Steve, how are you?
Senator, how are you? Are you here? Hey, good to see you. I hear you've had a busy morning.
It's been a great morning, though. We actually had a health conference here, and then a health meeting, and now this health conference.
I understand. I have all these great quotes from you this morning. And well, let me first ask you this. I heard Donald Trump is going to have lunch with 13 U.S. senators today. Are they the right senators?
You need 50 senators out of 52. So whatever you have at that luncheon table are the right senators. Ideally, we move towards President Trump's campaign pledges regarding health care, but it's going to take all of us. So whoever they are.
What are you doing at lunch?
What am I doing at lunch? My daughter's graduating from middle school today.
Okay, great. I just want to make clear that you weren't going to join the president to sort of share with him the contours of the Cassidy plan in healthcare. Let me ask you first, because many people have looked at you as the key vote on whether a Senate bill goes forward or not. This morning, you were quoted as saying that a House member had told you that the plan was House should just pass anything and the Senate will fix it. So I'm interested, is the Senate fixing it? Do you feel the Senate is fixing it? Have you seen the bill?
We've not seen final language. What we have been discussing...
You say we as meaning you have not seen final language either.
Well, there is not final language. Let's put it first that way. And in our kind of committee as a whole, the whole being Republican senators, there is an attempt to come to common ground. And it is recognized that the individual markets, for a variety of reasons, both pre-Trump and post-Trump inauguration, are imploding. There is a need to push out something to stabilize those markets ASAP. I think you saw Kevin Brady, the Ways and Means chair on the House side, saying that he thinks we should go ahead and allocate the money for the cost sharing reductions quickly to reassure insurance companies that the stability will be there so that they stay in the market. I think that sense is on the Senate side too.
You know, Senator, I wanted to share with all of you, those folks here in this room, and we've got a packed house, a little of your history, that after Hurricane Katrina, you personally got deeply involved in trying to provide health care, setting up a hospital for those who did not have coverage. And I'm interested in how that human experience of Katrina, you're a Republican senator, and it's not a story you often hear, but how has that informed where you think this legislation needs to go?
Well, probably the more pertinent part of my medical life, if you will, is I worked in a charity hospital for the uninsured and the underinsured for 25, 30 years, also setting up a clinic for the working uninsured, those that had to work during the day, maybe see a physician. And so my practice has been with the uninsured. I have learned in that hospital for the uninsured that if a politician controls your healthcare dollar, then ultimately that healthcare dollar serves those whom the politician has more interaction with, stakeholders, if you will. The patient should have the power. Ovik Roy was speaking about giving the power to the patient. If you give the credit to the patient, allow her to choose the coverage that she wishes, the system lines up to serve her. And I think that should be our goal, that we give the patient the power.
You were on Jimmy Kimmel's show recently, and you guys were talking about his child and the congenital heart issue his child has, and said we need a Jimmy Kimmel test. What is the Jimmy Kimmel test, and is the Senate legislation gonna meet that test?
In the context of that conversation, we were speaking about the need to lower premiums. There's middle-class families across the nation paying $20,000, $30,000, and even $40,000 for their policies with high deductibles. That is unsustainable. A major valid criticism of the Affordable Care Act. We need to lower those premiums. Now, there's a couple of different ways you can lower premiums, one of which is to give lousy coverage. We shouldn't give lousy coverage. What we do should pass the Jimmy Kimmel test, that if someone's loved one needs a procedure quickly, that the coverage is adequate for that procedure and then adequate for the sequelae. So we have to lower premiums, but it needs to continue to have credible coverage to pass the Jimmy Kimmel test.
You said this morning, as I understand it, that you thought that a repeal and replace would happen this summer because so many people have been running on this. And it just seemed to me that you were giving a discussion that it was going to happen because people said they had to support something. But what if that something is a bad vehicle? Are you going to be there?
One thing I mentioned this morning, quoting one of my fellow senators, there's three possibilities. One, we don't repeal, replace, that's bad. Two, we repeal and replace with something which is bad, that's bad. And three, that we repeal and replace with something which is good, and that is good. for the American people, for our country, for our economy, et cetera. And so it's that latter third option that I think we need to go towards. When people back home, middle-class families, have premiums, as I described, $20,000, $30,000, and $40,000, something has to be done. But I'm just pushing that which is done is good policy.
Now, you and Susan Collins have teamed up on the Cassidy Collins bill. I know Shelley Moore Capito from West Virginia, Johnny Isaacson are on board. Have you gotten any Democrats onto your alternative?
I've met about, I think I'm up to 10 Democrats.
Anybody privately, like at dinner parties, secretly say, hey, I really want to be on your bill, but Chuck Schumer would knock me out?
I've met with about 10 different Democrats. 3 people know about. There's 7 others I've met with to one degree or another. And they're under incredible political pressure not to break ranks. And that is regrettable, very regrettable. People criticize the fact that reconciliation is being used. I point out, well, wait a second. Because reconciliation is being used, meaning that you only need 50 or 51 votes, then it only takes 1, 2, or 3 Democratic senators to really help shape a bill in a direction that Democrats might wish it to be shaped. I'm just concerned about that middle-class family. Again, with those premiums she cannot afford, they live in blue states as well as red states. So my challenge to my Democratic colleagues is put that family before the politics, break ranks for her sake, and suffer, kind of the slings and arrows, but knowing that you've done the right thing.
Senator, let me ask you a perhaps uncomfortable question. I know that you're a doctor, you're substantive, you have substantive concerns about the Affordable Care Act. I've looked at the Louisiana Health Dashboard about the number of people who had expanded coverage testing, colon cancer screenings, breast cancer diagnoses, et cetera, that came as a result of Obamacare. I'm assuming that you think the legislation that you would support would broaden and improve that Louisiana health care coverage. I'm interested in the literacy of your colleagues. How many people do you think get into the gritty detail of the health ecosystem and understand it in trying to reform it? And how many people you think are driven by the name Obama, either pro or con?
I'll tell you that obviously there's 3 physicians and an optometrist in the Senate. So we're going to have more of a background. But I will commend my Republican colleagues we've been meeting with. They've all been kind of doing their deep dive, trying to come up to speed and coming up to speed on these issues. So there is going to be obviously partisan politics involved on both sides. You mentioned that may not even be viewed as partisan, but an outsider would suggest that. On the other hand, I do think there is a good faith effort to come up with policy which works for that middle class family. And I think that's our goal, and I think we're trying to achieve that goal.
Senator Cassidy, you're a fan of auto-enrollment, and I'm not normally a healthcare guy, and many of you guys are into this auto-enrollment notion more, but it sounds like a cute way to a mandate to me on the outside. So, in fact, you I think, are suggesting that with auto-enrollment, you actually get to numbers higher somehow than a mandate. And I'm just interested in taking us down that corridor for a moment.
Yes. Now, Steve, did you say that it's akin to a mandate?
I said a cute way to a mandate.
Now, acute as in
I'm being snarky.
It's chronic.
Bad attempt at snark. Yeah. So the question is with auto enrollment, which gets you very, as you've argued, like in 401ks and other, very, very high subscription rate. Is it just an ideology? I mean, what is the true difference as you see it between mandate and auto enrollment?
There is no relationship between the two. They are here and there, the East from the West. When someone gets on Medicare, they turn 65, they're on Medicare, they can call and say, I don't want to be. It's not a mandate. You never hear people complain about mandated that I'm on Medicare because you can get out. It is so clearly not a mandate. You're not paying a penalty if you're not in. You're just in unless you don't want to be. And I point out that Republicans have always said that government should serve the people, not the people of the government. Arguably, when on Obamacare, you have a 16-page online form you have to fill out, and W-2s and this and that, and if you don't get it right, you get penalized. That is a mandate, and the person is serving the government. On the other hand, if you say, hey, listen, you're in unless you're out, then the government is serving the person. That's a strong conservative push. And then I'll also say, by analogy, on tax reform, Republicans have always been about making it simple. What is simpler? Logging on, 16-page form, filling out everything and getting dinged if you don't get it? Or, hey, you're in unless you're out. The Republican proposal is the simpler one, which is you're in unless you're out.
Is the Freedom Caucus on board with auto-enrollment?
You know, I haven't spoken to them about this, and obviously individuals are going to have their own concerns. But I think if you, it's a dichotomous decision. Either you're going to make it so it's hard to get in, or you're going to make it so you're in unless you're out. And conservatives have always been about making government procedure easy. That is the conservative solution. Someone may consider it differently. In that case, why aren't they complaining about the way we enroll in Medicare? Or why aren't they going after Fortune 500 companies the way they enroll people in 401ks? If they're not a principled conservative. They're just kind of picking this opportunity to complain. I think the principled conservative is make it easy.
Senator, we have a very full room here in Boston with people from across the healthcare spectrum. Probably every kind of stakeholder you can imagine is in the room. And I'm interested in what you would share with them are the most important principles as they debate one way or the other, as they think about what's evolving in healthcare. What do you think you could share with these folks? I mean, oftentimes town hall people are telling what you think. What do you want to tell them they can do to be constructively engaged in the debate? What should their North Star be?
Speak to your legislator.
Oh, beyond that, we know that. We know that, yeah.
The principles that I bring, if I may say, Steve, is that the patient has to be engaged. Statistically, an activated patient is the patient who is more likely to have better outcomes at a lower cost. And there are ways to get there. The Healthy Indiana plan for their Medicaid expansion population gave lower income Indianians, or Hoosiers I should say, pre-funded health savings accounts. And if they contributed even a little bit of money, they got a little bit more. That created activated patients. They found that their ER utilization went down and that health outcomes improved. That's what we want. And whatever we do has to be sustainable. You mentioned these wonderful statistics coming out of Louisiana. The fact is that when Louisiana has to end up paying 10% of its Medicaid expansion expense, that'll be $310 million a year, which I don't think Louisiana can afford. For California, it's $2.2 billion a year. For Massachusetts, I think it's like some ungodly amount of money, maybe $1 billion a year. I don't have that in front of me. States cannot afford that 10%. So we've got to find ways in which the patient participates, in which your health outcomes improve, cost is lowered, and that you end up with a more sustainable system. Unless the system is sustainable and the patient is activated, we will be debating this again year after year after year.
Senator, I want to thank you for joining us. Thank you for this consequential discussion. You've got a very busy desk behind you. I love the backdrop, and so thank you. We should do this on a weekly basis. We can do 15 minutes with Bill Cassidy every week if you like. Ladies and gentlemen, Senator Bill Cassidy from Louisiana. Thank you so much, Senator.